Welcome to the online session for Wednesday the 23rd of October 2010. The session plan has been posted onto Blackboard for you, so please go through that and the different activities that are meant to be done over this week. The first item on the session plan is the formative assignment, which is voluntary. After today, I will have set up Turnitin where you'll be able to submit within the time limit. But the formative assessment is basically to ask you to look at some of the issues that we've looked at in the last few weeks during the modules. So in terms of formative preparation, I've asked you, if you want to, and it's not compulsory, to complete a 500-word account on what are some of the key issues in relation to adult social care. Clearly there is a link between this question and the summative assignment, and that's intended to be so. However, we're only halfway through the module and through the workshops, and you're not yet in a position to tackle the summative assignment. You are, however, in a position to respond to the formative exercise if you want to, and I'm sure that you will appreciate the relevance and connection to the summative assignment. Remember that the question that I've asked you has impact for both service users, carers and social workers themselves. Please see this within the context of the overall delivery of adult social care. Today's online session will look in particular at the fair access to care services. I'd like you to think of this within the context of personalisation overall. The fair access to care services is an integrated approach to the delivery of adult social care. It has been in existence for quite some time, but in particular we've had some revisions to it, not least in 2010. What I'd like you to do during this session is to go through the module on Sky website on the e-learning resources and have a look at the module that deals with fair access to care services. It will explain the history, the background, the changes and the amendments to, and the current situation right up to 2010. What it won't do is to introduce you to some of the future changes in relation to fair access to care services. For example, and specifically related to the Adult Care and Support Bill 2012. We looked at this in lectures 1 and 2 and 3 in particular. And in particular, we looked at, under legislation and social policy, the notion that personalisation, or in fact the reality that personalisation, is the main focus of delivering adult social care. We've also mentioned that a lot of the language that we use now is used within the context of an economic framework. The language in terms of adult social care is very much aligned to the economic principles of demand and supply. However, you will also notice that the principles are also linked to outcomes and inputs and intervention. When you go on to the Sky module of adult social care, you will see that many of the activities are specifically designed towards person-centered planning, self-directed support, personalization, personal budgets, direct payments, and finally commissioned care. Interestingly, the latter, commissioned care, is probably going to be more of a rarity in the future, in that within the economic framework, the principle of demand and supply takes precedence in terms of the person's choice and the person's choice to consume or avail of a particular service. So the individual service user becomes the center of commissioning activity. And if personalization is taken to its logical end, the individual commissions a service that is intended and linked specifically to their own outcome. And the idea is that in the long term, this will benefit the individual in terms of independence and re-ablement, and not move towards a universal purchase of universal services that might not actually meet individual needs, but basically serve a demand within society. Now, these are all fairly complex arguments because they introduce us to the notion of effective intervention. Where possible, it's always going to be the case that the preference is that the individual is always able to make the choice and the decision. And that's quite a different way and approach for social workers in terms of approaching supporting service users and carers. Service users in particular will experience and participate fully in the self-assessment process. In some respects, this brings us back to very much the community-based social work activity, where social workers were involved in supporting individuals in the experience and process of self-actualization. So the individual takes the lead. Now, over the next few weeks, we will also see that even with this ideal of person-centered planning, there will be issues as safeguarding, risk assessment, and formulation of care plans that will be integral to the social work role within adult social care. Specifically, it is intended by the College of Social Work and other bodies aligned to developing the training and development of social workers post-qualifying, that social workers in particular, in terms of adult social care, would only deal with the more complex cases. I think that this probably makes sense given the level of training that you will receive, and particularly with the amount of law and the amount of legislation that you are required to know and to be familiar with in terms of your practice. Now, bringing us back to the fair access to care services. You need to see this, as I said earlier, as an integral part and process to personalisation. In some ways, it might have been easier to have done the fair access to care services first and then personalisation, because it's so integrated in terms of part of the process. However, I've chosen not to do that, and the reason I've chosen not to do that is that under the guidance, particularly with regard to personal budgets, personalisation, and person-centered planning, the notion of financial eligibility is not something that should be considered in the first or early stages. So the issue of financial contribution or financial assessment is very much the last stage. So the needs are identified, the care plan is identified, the issue in terms of outcomes is identified, and the issue in terms of co-productivity, and remember when I said co-productivity, using the economic framework language, what we're really saying is the networks, the support, the informal support that do not effectively, at least overtly, cost the state money, are necessary in the delivery of good outcomes. So co-productivity usually means collaborativeness and networking with the informal network, be they carers, family, church, community-based support networks, or friends. What I'd like us to do now is to have a look. I want to just run through very quickly the 5 stages in the module that I just want you to have a look at in terms of the fair access to care. If you work through the exercises, you'll get an idea of what the main key elements are. But the main key element really is to look at the issue of eligibility. Now, under the current framework, and that's the 2010 framework, the issue of eligibility is divided into 4 elements: low, moderate, substantial, and critical. Now, in the current economic climate, one of the issues that in most local authorities and most areas where joint funding exists in terms of the commissioning of services, low and moderate would ordinarily not secure any kind of care package. And it's unlikely that care packages would be invested in. However, that said, under the Care and Support Bill 2012, which hasn't yet become law, and there's been a number of discussions and revisions, the notion of fair access to care has been revisited. So I think there are going to be some fairly significant changes if applied in law in perhaps 2013, 2014. One of the provisions that I think will probably happen, but we have to watch this space, is that the categories of low and moderate may not necessarily exclude people from receiving or obtaining advice in terms of care. If the Care and Support Bill succeeds in the way that it's currently legislated and proposed, then the right to receive an assessment or the right to be considered in terms of the personalisation process, it is a universal right. However, here's the key distinction, and this is the key element that I want you to kind of take note of. The right to provide, or the entitlement to receive services, is not universal. Now that's quite significant. So you may have the input in terms of assessment, you may have the advice, you may have the sign-keeping or gatekeeping or signposting towards other services, but that doesn't necessarily mean that the local authority or others will commission services. And that's maybe where the issue of eligibility might come into the fore. So eligibility in terms of low and moderate may still attract assessments, but may also, in some cases, attract some creative thinking on the basis that even if someone's need is moderate and low at this particular moment in time, maybe it's worthwhile investing in that particular situation in terms of outcome focus, because in the long term it will prevent the individual from actually requiring a much more expensive care package, which may be having to come out of public funds. Now you may be wondering, and you may be thinking, well, why all the argument about economics and finance and funding? And I think what I would say to you is that you need to kind of see these things within the context of many competing variables. And maybe I could say that no